I decided to go ahead and use this very short paper for making a couple of points on adaptation for the health sector. I have an entire course on climate change and health, lots of details there in terms of climate impacts on health, which includes some of the mitigation measures which for reducing the impacts, which amounts to adaptation. This particular paper is very short, makes a couple of points on climate adaptation for the health sector in the context of infectious diseases. As you know, COVID came and went, hopefully gone, and lots of disease modeling became big news because lots of media reports were using infectious disease outputs from several groups, Columbia University, Oxford, and so on, to Johns Hopkins, to say how COVID is going to spread. None of them did very well because often these models require lots of data to run, the so-called SIR and SIER models, which I have discussed in my course on climate change and health a little bit. So those the infectious disease, of course, because of global connectivities, there are environmental connectivities related to climate impacts, and there are physical connectivities because of the ease of travel across the world. I'm going to leave tomorrow for Budapest for a short vacation. So I have to adjust my carbon footprint elsewhere for that. But nonetheless, such short trips across the world, or long trips, whatever, people movements, are obviously very conducive to infectious disease spreading as well. So let's just make a couple of points to use this as a placeholder. As I said, if I find more literature that's worthy of adding, I'll add as I go along. I keep having this section in each course called New Findings. So I may have a New Findings section for this course on climate adaptation, where I'll add new reports, publications, new results, and so on. Generally speaking, schematically, mechanisms of climatic influences on infectious diseases, not very surprising. We have seen this in many ways. The AR6, AR5, all the IPCC assessment reports always include health impacts as well, and they have such figures. Changes in baseline climate, so background mean temperatures, rainfall, winter days, summer days, etc., affect cycles of vectors and pathogens. So there are endemic diseases as opposed to pandemics like the COVID-19. Expansion of geographic distribution of diseases. So Lyme disease has gone all the way into North America, which is really a tropical disease. Chikungunya, malaria has been now again directly infected endemically in US this year in 2023. Mosquitoes are expanding their altitude range as well as latitude range with warming, and they get transported by ships and aircrafts and so on as well. This has impact. Climate change has an impact on extreme events and has direct indirect effects on extreme events as well as direct effects, and they can feed back to climate change. And indirect effect here include population displacements, climate refugees, poor nutrition that we talked about in the agricultural adaptation, damage to healthcare infrastructure, which is always critical, especially for poor people, vulnerable people. They may get stranded or may not have the wherewithal to go to healthcare systems, or they simply may not be able to afford healthcare as well. So extreme events then include water-associated diseases, poor hygiene, air quality, vector-borne diseases, zoonotic diseases with population increase and occupation of more of the coastlines and woodlands and so on. So waterborne diseases also include harmful algal blooms and contaminated fish, and this cascade is quite vast. I have a very strong breeze here, which I hope is okay in terms of the recording. So looking briefly at the adaptation strategies for infectious diseases in relation to climate change, we can start with anywhere, but access to services is critical in terms of healthcare, which affects protection of population's health, which is also affected by reduction of the risk of infection itself, which is affected by infectious disease control. Each country has mechanisms of trying to do this. So in that we get early warnings, which I have entire course on in terms of subseasonal to seasonal forecast for health, for example. Epidemic warnings, targeted surveillance, which happened a lot during the pandemic but wasn't as effective in terms of sharing data, etc. Vector control, which is done a lot in tropical countries, but some fumigation is some very noxious stuff. I don't know what it does to my health. As I'm walking around, a jeep goes by and sprays this smoky vaporized liquid which stinks like hell. So this infectious disease control is getting a feedback in the health sector and also feeding back to healthcare. So other sectors are involved, like sanitation, which decides waterborne diseases and their outcomes, depends on socioeconomic vulnerability as well. So civil defense there is critical, and meteorology and early warning systems are of course critical, and they feed back to reduction of risk of infection as well. So simple things like cholera, probability, filtering water, or E. coli, boiling water, all these things can come out of these kind of warnings. Okay, so very quick, but this is also covered in much more detail in my course on subseasonal to seasonal forecasts for health, as well as the course on climate change and health. Okay, so you can look those up. I'm putting this here just as a placeholder to say adaptation must also worry about sector like healthcare. Okay. They state this as well. An adaptation strategy within the health sector should be focused both on primary prevention, so reduction of exposure to infection, and secondary prevention like healthcare after you have been infected, so that you don't continue to infect others and recover yourself, so that other economic impacts like lost labor, productivity, etc. are controlled as well. Important health adaptation actions include, not comprehensive, but enhancement of epidemiological surveillance actions targeted to specific territories due to the expected expansion of the distribution of endemic infections is the emergence this sounds not so well written. Emergence of diseases in new areas. This would be guided by information from climatic scenarios downscaled to specific regions and their implications in relation to disease cycles. Okay. What do we mean? Basically, we are again going to translate climate projections based on scenarios to disease cycles like crop modeling and try to take decisions based on those. So their enhancement of epidemiological surveillance actions targeted to specific territories due to the expected expansion of the distribution of endemic infections is the emergence of disease in new areas. I hope that sentence makes sense. Unsure why they wrote it this way. Development of early warning systems for epidemics, especially after extreme hydrometeorological events like the massive flood that's happening in Delhi right now in July 2023, such as storms and floods. Outbreaks of storm-associated waterborne and mosquito-borne infectious diseases are commonly reported after these events. So you cannot avoid large-scale hazards like extreme rainfall events. They are controlled by global dynamic factors, but how you control the minimization of the explosion of diseases and how you do primary and secondary preventions is very critical in terms of adaptation. Within the field of health systems, strategies to facilitate access to healthcare services would assist in early detection and treatment of infections and thereby potentially outbreaks. This should preferably be directed to the more vulnerable populations and territories. So pandemic was handled very well in India, for example, in terms of surveillance, monitoring, vaccinations, quarantines, services, etc. Important adaptation actions are also those focused on specific diseases and vector control programs, including entomological surveillance. The goal of these actions would be a reduction of the risk of infection through the reduction of the populations of pathogens, vectors, and animal reservoirs of infections. So mosquito population could be animals, rats, and so on in terms of vectors. Could be wearing masks to be a vector yourself, to prevent being a vector yourself, and so on and so forth. So as I said, this is just a brief placeholder to look at climate change adaptation in the health sector. This one little mishmash, but nonetheless you get the idea that climate change adaptation in the health sector is very critical as well.